Doctor shares 6 ways to reduce bowel cancer risk. 54% of cases, preventable.
Also known as colorectal cancer, bowel cancer accounts for 10% of all cancer deaths in the UK, making it the second most deadly form of the disease in the region. It is also the 4th most common type of cancer in the UK, with more than 42,000 new diagnoses each year. But more than half of these cases could be avoided by adjusting certain lifestyle habits, an expert has said. GP Dr. Anisha Patel, who was diagnosed with stage 3 bowel cancer in 2018, spoke exclusively with Express.co.uk. Following 2 surgeries and 3 months of chemotherapy, the mum of 2 is now in remission. 54% of bowel cancers are preventable, she explained. Dr. Patel, from Dorking in Surrey, shared 6 ways to lower your risk of developing bowel cancer, including 2 diet-specific changes to make. She said, eat a high-fiber diet. We know 9 out of 10 people do not eat the recommended amount each day, which is 30 grams a day for adults. This is known to cause nearly a third of preventable bowel cancer cases. Encouraged to look out for high-fiber food swaps, such as swapping white bread and pasta to brown and eating at least 5 portions of fruit and vegetables a day. Not only does a high-fiber diet reduce your risk of bowel cancer, it will reduce your risk of strokes, diabetes, high cholesterol, and prevent constipation and improve your gut health, which we know can affect the body and mind in many ways. Dr. Patel continued, reduce your red meat and processed meat consumption. Government guidance suggests anyone consuming more than 90 grams of these products a day should reduce their consumption to less than 70 grams a day, which is equivalent to 5 slices of thin ham, 1.5 cooked sausages or 5 tablespoons for cooked bolognese. Encourage meat-free days and meat swaps for lentils, veggie mince and turkey mince. Her other tips for lowering the risk of bowel cancer include reducing alcohol consumption, ensuring regular physical activity and movement, stopping smoking, losing weight if overweight. Dr. Patel, now aged 43, experienced several symptoms before her bowel cancer diagnosis. As is common, some of these involved her bathroom habits and included constipation, feeling like she wasn't completely finished after going to the toilet and blood appearing on the toilet paper. She also felt tired a lot of the time and started losing weight while on holiday. When these symptoms worsened, she sought medical help. Dr. Patel encouraged others to speak to their GP as soon as they notice a change. There are lots of potential causes for your symptoms, so please don't assume that you have bowel cancer, but it is important to get the right examinations and tests to check, she added. Doctors have seen it all before and try not to feel embarrassed about seeking help. It's also important to know you're normal, so if something does change and is persistent, you seek medical advice early on. Common symptoms of bowel cancer include changes in your poo, such as having softer poo, diarrhea or constipation that is not usual for you. Needing to poo more or less often than usual for you. Blood in your poo, which may look red or black. Bleeding from your bottom. Often feeling like you need to poo, even if you've just been to the toilet. Tummy pain. Bloating. Losing weight without trying. Feeling very tired for no reason.